Men between 40 and 65 often wonder if they still measure up. It's a question whispered in locker rooms, searched in private tabs, and hidden behind humor. But what if the truth wasn't what you expected? Dr. Vera Sterling, a board-certified urologist and researcher, has spent over 2 decades studying male anatomy and female sexual satisfaction. Her findings are both shocking and liberating. Forget the myths from magazines and movies. Science tells a very different story about what truly matters to women in intimacy. Today, Dr. Sterling breaks the silence with medical truth, compassion, and evidence that might just change your confidence forever. The medical truth behind size and satisfaction, 700 words. For most of her career, Dr. Vera Sterling has seen one pattern repeat endlessly: men silently carrying anxiety about their size. Patients in their 40s, 50s, even early 60s come into her office not because of dysfunction, but because of doubt. They lower their voices, ask indirect questions, or pretend to be inquiring for a friend. Beneath every word is the same fear that they are not enough. In the field of urology, these conversations are not new. What is new is the science that finally sheds light on what women actually find satisfying, and it has nothing to do with the unrealistic ideals seen online. According to multiple peer-reviewed studies, including those published in the Journal of Sexual Medicine and British Journal of Urology International, BJUI, the average erect penile length is approximately 5.1 to 5.5 inches. But what truly surprises most men is that women, across global surveys, consistently rate 4.8 to 6.2 inches as their ideal range. Anything beyond that, the data shows, doesn't significantly increase pleasure, and in some cases, can even cause discomfort or physical pain. Dr. Sterling explains this from a medical standpoint. The female vaginal canal averages about 3 to 4 inches in depth when unaroused and expands to around 5 to 7 inches during full arousal. It's a perfectly designed system, sensitive, adaptable, and more responsive to motion, rhythm, and emotional connection than to size alone. In her clinical experience, what enhances female satisfaction most are not inches, but intimacy, blood flow, stamina, and sensitivity. However, the male mind often latches onto visual comparisons rather than biological realities. In her private consultations, Dr. Sterling often uses anatomical diagrams to illustrate what women actually experience during intercourse. Size anxiety, she explains, is a psychological distortion, fed by unrealistic media portrayals and deep-seated masculine insecurities. Over time, it can erode confidence, cause performance anxiety, and even lead to mild erectile dysfunction caused by stress and cortisol spikes. Interestingly, newer technologies like MRI scans and ultrasound mapping of the pelvic region have allowed urologists to visualize how the penis and vaginal canal interact during intercourse. These studies reveal that beyond a certain point, the additional length doesn't enhance contact with key erogenous zones like the G-spot or clitoral network. Instead, optimal stimulation is achieved through consistent pressure, blood flow, and synchronized movement, factors that are linked to vascular health, hormonal balance, and psychological comfort, not size. That's why Dr. Sterling spends much of her consultation time focusing on circulation and confidence. She reminds her patients that penile tissue is primarily vascular, meaning that proper blood flow, not physical dimensions, determines erection quality and endurance. Men over 40 often experience reduced nitric oxide production, arterial stiffness, and minor testosterone decline, all of which can impact performance far more than size ever could. To combat these issues, she often recommends natural interventions before medication, improved diet, regular aerobic exercise, stress control, and sleep optimization. Foods rich in L-arginine, omega-3 fatty acids, and antioxidants can improve vascular elasticity. Even a 20-minute brisk walk daily can enhance blood flow to the pelvic region. Dr. Sterling often sees a transformation after just a few weeks of these changes, not just physically, but emotionally. Men begin to realize that the core of sexual confidence lies in health, not measurement. Their partners report better satisfaction too, because genuine connection and presence replace anxiety and self-comparison. Yet, There remains one more layer that Dr. Sterling emphasizes: the emotional connection between body image and identity. Many men define their self-worth by performance metrics that biology never intended to be competitive. In her words, the most powerful organ for intimacy is not between your legs, it's between your ears. When men understand that, their entire perspective changes. As Dr. Sterling reviews her patient notes one late evening, she pauses at a common pattern. Improved emotional well-being almost always coincides with improved erectile function. Confidence fuels arousal, calmness sustains it, and when both partners feel secure, satisfaction naturally follows, regardless of size. But her next discovery, the one that startled even her colleagues, came when she began analyzing how women's stated preferences changed with relationship depth, emotional trust, and hormonal cycles. What she found redefined everything science assumed about attraction. What if the answer to how much is enough had nothing to do with size at all, but with timing, trust, and chemistry? Dr. Vera Sterling, an experienced urologist and medical researcher, reveals the next chapter of her groundbreaking study. Her data doesn't just measure inches, it measures connection, satisfaction, and emotional resonance between partners. What she uncovered shocked both men and women alike. Physical preference is not fixed. It evolves with emotional intimacy and biological rhythm. For men over 40, this discovery isn't just science, it's liberation from a lifetime of quiet comparison and misplaced shame. The psychological and biological secrets. Behind female preference, when Dr. Vera Sterling began her second phase of research, her goal was simple but profound: to understand why women's preferences vary so widely and what deeper factors influence sexual satisfaction beyond anatomy. The results were astonishing. Using data from neuroendocrine studies, psychosexual surveys, and hormonal mapping, she confirmed that a woman's perception of her partner's desirability and even size preference changes with emotional closeness, hormonal cycle, and relationship duration. In early attraction phases, elevated dopamine and norepinephrine levels heighten excitement and novelty-seeking behavior. This often leads to a stronger visual and physical emphasis. However, as relationships mature, oxytocin and vasopressin, known as the bonding hormones, reshape the female brain's reward pathways. This transition shifts attention from physical characteristics toward emotional safety, trust, and compatibility. In practical terms, what once looked big enough in early courtship becomes less about inches and more about intimacy, rhythm, and mutual understanding. Dr. Sterling often presents this to her patients with both clinical precision and empathy. She explains that the female body is biologically attuned not to sheer size, but to connection and response. The most sensitive areas, the clitoral network, inner labia, and anterior vaginal wall, are stimulated not by depth, but by pressure consistency, arousal buildup, and partner synchronization. This explains why many women, when surveyed anonymously, admitted that emotional arousal and partner communication were more significant predictors of orgasm than size. One of Dr. Sterling's most cited findings came from a study she co-authored on neural reward, adaptation in long-term sexual relationships. In it, brain scans showed that when women experienced deep emotional intimacy with their partner, their physical satisfaction ratings increased by up to 40%, independent of their partner's size. Simply put, the mind amplifies physical pleasure when trust and affection are present. For middle-aged men, this understanding is revolutionary. The male body naturally changes with age. Testosterone dips slightly, recovery slows, and stress hormones sometimes interfere with arousal. Yet, as Dr. Sterling reassures her patients, none of these changes diminish desirability. In fact, mature men often bring the emotional, intelligence, and patience that are proven to enhance female pleasure more effectively than physical extremes. Dr. Sterling has seen countless couples rediscover their spark not by altering anatomy, but by changing awareness. She encourages men to focus on 3 key dimensions: communication, blood flow, and presence. Communication builds safety, blood flow ensures stamina, and presence, true, undistracted engagement, creates the emotional resonance that women crave. She recounts a patient in his late 50s, a retired engineer, who confessed to years of quiet insecurity after his divorce. Through guided therapy and health optimization, he learned to reconnect with his body's natural rhythm. Within months, his confidence and his partner's satisfaction rose dramatically. He didn't change his size, Dr. Sterling recalls. He changed his mindset. From a strictly medical viewpoint, Dr. Sterling stresses that penile size is largely genetic and difficult to alter meaningfully without surgical risk. Instead, she focuses on function, blood flow, nerve health, and psychological readiness. Treatments like pelvic floor exercises, low-intensity shockwave therapy, and bioidentical testosterone management can improve erectile performance safely. But even then, she insists that physical improvements mean little without emotional congruence. What her years of research ultimately proved is this: women want connection that feels big, not just looks big. Size may capture curiosity, but emotional safety captures desire. For many women, ideal is not measured in inches, but in effort, attention, and affection. As Dr. Sterling reflects on her decades in urology, she believes the next frontier in sexual medicine lies not in enhancement, but in education, teaching men that their worth isn't confined to anatomy. She sees every patient as a chance to dismantle myths and replace them with truth grounded in both compassion and science. In her final published conclusion, she wrote words that continue to resonate with men across the world. Confidence doesn't come from how much you have. It comes from how well you understand what truly matters. Dr. Vera Sterling's research reminds every man that satisfaction is not a competition of measurement, but a collaboration of connection. And for those who still carry old doubts, she leaves them with this: the most powerful performance enhancer is not found in a pill, a clinic, or a ruler. It's found in understanding yourself, your health, and the person you love. Dr. Vera Sterling's scientific truth about desire, size, and satisfaction.